Thanks for staying tuned to Channels Television. Welcome to Health Matters. I am Yomi Otaibi. On the show today, we'll be wrapping our discussion around the effects of overuse, underuse, or misuse of medicines, and also how you can achieve safe medicine use. Our guest today is a practicing pharmacist who is also the managing director of Timotech Pharmacy here in Lagos. Mr. Timothy, would you thank you for joining us?
Thank you.
Okay, we're looking at safe medicine use. As a pharmacist, how would you describe medicine itself?
Medicine could be generally described as substances that have been carefully formulated, designed, and manufactured according to the GMP standard for the treatment of diseases.
So they are very essential when it comes to healthcare delivery. But it's been said that as much as they can be very helpful in getting people, well during sickness or illnesses, they can also be dangerous.
Yeah.
How true is this?
Drugs could be beneficial to the people if taken according to how it is prescribed, especially the prescription drugs. At the same time, if the dosage are not, the patient do not comply with the recommended dosage, it could cause some serious crisis or medical complications or health issues in man.
So it's both ways. Yeah. Now let's look at how to achieve safe medicine use. What is the first thing that should come to mind when it comes to medicine? We should all know that medicines are substances that can cause a lot of health issues in the body system. And they come in various colors, as we can see. Syrup, on the screen right now we can see syrup, we can see tablets. So
yeah, they come in different formulations, different dosage forms. We have the tablets, we have the capsules, we have the syrups, especially in children that cannot swallow tablets. So they comes in different forms. Then we have the injectables too. So in different forms.
Okay, so you were talking about what it entails, when we talk about safe medicine use.
Yeah. Generally, what the safety of medicine is of drug use is we need to take it as a very serious issue, in the sense that we encourage people that drugs should never be taken, especially the prescription drugs, should not be taken just like that. Whenever you detect an illness, you just have to see your doctor, get your prescription, then to be taken to a pharmacy, because to get the right medication according to the prescription that has been given from the hospital. So, but it is unfortunate that generally the way just take drugs, people just take drugs anyhow.
Self-medication.
Self is a very big issue, especially in our country, Nigeria, among the young, the old, and even the elderly. And most of this, if we continue to do this, there could be a lot of serious health implications of taking drugs without proper, maybe not getting adequate proper prescription from the hospitals or from the doctors.
So what could these implications be?
And like anybody that is taking drugs just anyhow, there are some organs in the body that can be in a serious risk like the liver, the kidney. There could be a lot of problems on these organs if drug is being taken inappropriately.
There's also this issue where you find perhaps a friend, a sister, or a neighbor who seem to have the same symptom, like somebody the neighbor who has had the same symptom and has gone to hospital, and then the doctor has said, okay, you can use this XYZ medicine, and then you come up and say, okay, I think I have this, you have the same symptom like me, okay, let me tell you, this was what I used. You know, I think that's also part of the issues that we are dealing with.
Yeah, it is another... That's
sharing prescription.
Yeah, it is a very big issue too, that can cause serious health problems, especially. We advise that people should stick to what it is being recommended for them. You don't share your medications with another person, because even if somebody have the same, present a case, a medical issue to you, it may not be the same issue that you have. So it is not really good for us to be sharing our drugs with another person.
Okay, now let's look at drug reaction.
Yeah.
There's in medicine, it also happens, you know, sometimes the combination of drugs that is given, if you don't tell your doctor, for instance, that perhaps I've used this kind of medication before, maybe you're seeing another doctor and then he prescribes another thing, and you know, sometimes there's this drug reaction. Tell us about it.
It is drug reactions, possibility of two drugs, especially when there is a prescription that carry more than one drugs. There is tendency for some chemical reactions. For example, like the component of some of these soft drinks, benzoic acid, that is being used as preservative, that should not be taken with ascorbic acid, because